condition that affects millions of people worldwide. Today we'll unravel the mysteries of high blood pressure and empower you with knowledge to take control of your cardiovascular health. So, let's get started. High blood pressure, hypertension. High blood pressure, also known as hypertension, is a condition characterized by elevated force exerted on the walls of blood vessels by the blood flowing through them. This increased pressure places a burden on the heart over time and raises the risk of developing severe health issues, including heart disease, stroke, and other complications. Understanding blood pressure. Blood pressure is measured using two numbers, the top number known as the systolic level and the bottom number known as the diastolic level. For example, 140/90. 140 is the systolic level and 90 is the diastolic level. The systolic level represents the pressure exerted on artery walls when the heart contracts and pumps blood, while the diastolic level reflects the pressure when the heart is at rest between beats. Blood pressure readings are typically expressed in millimeters of mercury. Symptoms of high blood pressure. High blood pressure often remains silent, with individuals being unaware of their condition until complications such as strokes or heart attacks arise. In some cases, when the blood pressure is exceedingly high, individuals may experience occasional symptoms such as headaches, dizziness, or vision changes. However, these symptoms can be caused by other factors or other conditions other than high blood pressure, so it is important to seek medical advice if these are experienced. Diagnosing high blood pressure. Diagnosing high blood pressure requires multiple blood pressure readings taken on separate occasions. A single high reading does not necessarily indicate hypertension because blood pressure can fluctuate throughout the day due to several factors such as stress, physical activity, and food intake. To obtain an accurate diagnosis, healthcare professionals may recommend monitoring blood pressure outside of clinical settings, such as at home or through ambulatory measurements. This is because just by being in a doctor's surgery, your blood pressure may be elevated due to a level of anxiety. This is known as white coat syndrome. I will discuss how to accurately measure your blood pressure a little later in the video, so stay tuned. Why is high blood pressure a problem? High blood pressure poses significant risks to health over time. The presence of high blood pressure contributes to the development of atheroma, which are fatty lumps that form within the blood vessel walls. This in turn can damage the blood vessels, arteries, and strain the heart, increasing the likelihood of developing cardiovascular diseases such as angina, heart attacks, strokes, mini-strokes or TIAs, and peripheral arterial disease. Causes of high blood pressure. While the exact cause of high blood pressure is not always clear, several factors can contribute to its development. These include having diabetes, especially type 2 diabetes, being of African, Caribbean, or Indian subcontinent origin, having a family history of high blood pressure, being overweight, consuming excessive amounts of salt, leading a sedentary lifestyle, excessive alcohol consumption, and experiencing elevated levels of stress. By addressing these factors and adopting a healthy lifestyle, most individuals can actively manage their blood pressure and reduce the risks associated with high blood pressure. How is blood pressure measured? The initial blood pressure reading is usually taken in a clinic or GP surgery by a doctor or nurse, using a standard blood pressure machine. If the first reading is found to be high, your healthcare provider may recommend a period of observation. Home blood pressure readings. In some cases, you may be given a blood pressure machine to take your own readings at home. Home blood pressure readings are taken while seated and at rest, using a standard blood pressure machine. It is typically recommended to take readings twice a day for a week, resulting in 14 top, systolic, and 14 bottom, diastolic, readings. By calculating the average of these readings, you can obtain a more accurate representation of your blood pressure. It is important to note that blood pressure can naturally fluctuate, so a single elevated reading is not a cause for concern. Ambulatory blood pressure readings. Ambulatory blood pressure readings are taken at regular intervals throughout the day while you engage in your usual activities. This is done using a small machine attached to your arm, which automatically records the readings over a 24-hour period. The average of these ambulatory blood pressure readings often provides a more reliable assessment of your typical blood pressure levels. However, if an ambulatory machine is not available, home blood pressure readings can serve as a suitable substitute. It is worth noting that ambulatory and home readings tend to be slightly lower, and sometimes significantly lower, than readings taken in a clinic or GP surgery. This is because people tend to be more relaxed and less stressed in the comfort of their own homes compared to a formal medical setting. By utilizing different methods of blood pressure measurement and monitoring, healthcare professionals can obtain a comprehensive understanding of your blood pressure patterns, leading to more accurate diagnosis and appropriate management of hypertension. Tests for high blood pressure. When diagnosed with high blood pressure or hypertension, your doctor may conduct several routine tests to gather more information and assess your overall health. These tests include urine test. This test checks for the presence of protein or blood in your urine, which can indicate kidney damage or other underlying conditions related to high blood pressure. Blood test. A blood test helps evaluate the normal functioning of your kidneys and assesses cholesterol and glucose levels. It provides valuable information about potential risk factors associated with high blood pressure. Electrocardiogram is a non-invasive test that measures the electrical activity of your heart. It helps detect any abnormalities or signs of damage caused by high blood pressure. The blood and urine tests are usually done yearly. The purpose of these examinations and tests is to rule out or diagnose any secondary causes of high blood pressure, such as kidney disease. Assess the impact of high blood pressure on the heart and check for associated complications. Identify other risk factors like high cholesterol levels or diabetes early on so that these can also be addressed. How to reduce high blood pressure. My next video will be discussing all the natural ways to reduce high blood pressure in more detail, so turn on your notifications if you would like to be informed when the video is released. In many cases, lifestyle changes can significantly contribute to managing high blood pressure and may even help some individuals avoid the need for medication. Here are some key strategies. Weight loss. If you are overweight, losing weight can have a positive impact on your blood pressure. Alcohol intake. Limit your alcohol consumption within recommended guidelines, as excessive drinking can raise blood pressure. Sodium restriction. Reduce the amount of salt in your diet, as excessive sodium intake can contribute to high blood pressure. Regular exercise. Engage in regular physical activity, as it helps lower blood pressure and improves overall cardiovascular health. Quit smoking. Although quitting smoking itself does not directly reduce blood pressure, it significantly reduces the risk of complications associated with both smoking and high blood pressure, such as heart attacks and strokes. Medical treatments for high blood pressure. Treatment approaches for high blood pressure depend on several factors, including the severity of the condition and the presence of underlying health issues. If lifestyle changes on their own are not enough, then medication is often recommended in addition to lifestyle modifications. Here are some considerations. Medication and lifestyle changes are usually advised if you have persistently raised blood pressure, meaning clinic blood pressure between 140/90 mmHg and 159/99, and home or ambulatory blood pressure average of 135/85 to 149/94. Individual factors. Treatment decisions may also be influenced by factors such as age, ethnicity, underlying medical conditions, and the average blood pressure recorded through ambulatory or home monitoring. Medication options. Various medications are available to manage high blood pressure, and your doctor will determine the most suitable one for you based on your specific needs and any potential side effects. Regular monitoring and adjustments to medication dosage may be necessary to ensure blood pressure control and long-term cardiovascular protection. By undergoing necessary tests and working closely with your healthcare provider, you can develop an effective treatment plan that includes lifestyle modifications and appropriate medication to manage high blood pressure effectively. Regular follow-ups and blood pressure monitoring will be crucial to assess treatment effectiveness and make any necessary adjustments. That's all for today. I tried to make hypertension super simple for you. My wish is that this information will be a helpful resource for either you or someone you love. As a full-time doctor, my goal with this channel is to share my medical knowledge with all of you to help improve your overall health and well-being. If you found this video useful, please consider subscribing for more helpful content just like this. I'll be publishing a new video every week, so if you have any suggestions for future topics, please leave a comment below. Until then, take care of yourselves and stay healthy.